With the mission to create a network of quality healthcare service providers up to village levels at affordable costs, the first Rockland Hospital was set up in the year 2004 under the Trust Foundation for Applied Research in Cancer, which later transferred all operations and management rights to Rockland Hospitals Limited in the year 2007. To better understand the healthcare industry's needs, Rockland conducted a survey with a sample size of 3,000 doctors across the market. The findings indicated that the doctors operating out of smaller hospitals and clinics needed organized support in diagnostics, emergency, secondary, and tertiary care services. The answers clearly lay in building a healthcare value chain that could connect all providers to ensure access to quality healthcare to people living in remote areas, backed by a strong infrastructure, investment, technical and operations management support. These findings were only reaffirmed by independent studies conducted by the Times of India newspaper group and Publicis, one of the largest advertising agencies of the world. In the last 10 years, Rockland Hospitals Limited has built a chain of 3 tertiary care hospitals with a total bed capacity of 808 in the Delhi NCR region. Land has already been acquired for adding another 500 beds at Noida, along with plans of creating a paramedical training institute. With this, the major capital-intensive part of the envisioned 5-layered network model has been realized. The goal now is to seamlessly connect Rockland's tertiary care hospitals spread across the Delhi NCR expanse with all the peripheral secondary and primary care centers and health volunteers through a strong IT and telecom interface. The extensive experience of Rockland's entrepreneurial team in successfully building and managing businesses involving widespread distribution networks in India and abroad has contributed to some valuable insights needed to plan and create the healthcare delivery model. The added bandwidth of functional expertise brought in by Rockland's leadership team, coupled by the operational excellence capabilities of the middle management team, has only enabled the organization to accelerate on executing on its vision in the recent years. Rockland crossed several milestones before reaching the takeoff stage it has reached today. Quality healthcare was our focus right from inception. Back then, in the year 2004, Indian healthcare industry was not run by defined quality and process parameters. To take lead, Rockland conducted an industry seminar on quality and immediately after was chosen as the pilot assessment center for NABH, which now sets the quality standards for all hospitals and healthcare providers in the country. A testimonial of our quality centricity was when India Today magazine declared Rockland to be amongst the top 5 hospitals in India in the year 2009. The Economic Times, India's #1 business newspaper, selected Rockland Hospitals in its Emerging Leader series on the basis of its unique healthcare delivery model undertaking. ET Now, the Economic Times TV channel, has shared this model nationally as a worthy case study for other players in the market. The All India Institute of Medical Sciences, the #1 medical institute in India, had recently invited the Rockland team to share their 5-layer delivery mechanism in a seminar on innovation and entrepreneurship in healthcare. This was a rare honor as well as an acknowledgement of Rockland's model of healthcare delivery. What makes the Rockland Healthcare Solutions scalable and financially viable is its focus on managing costs well. Rockland has been very successful in creating clinical packages for almost all major procedures, which has helped it in keeping costs under control. Per patient revenue and margins is tracked in addition to per bed revenue. Moreover, the healthcare technological solutions which were earlier either not available or affordable are now well established, and technical partnership models are now being used across industries. Rockland is proactively working to capitalize on the market opportunities available to implement the network model and create value for all stakeholders. For the patients, the key benefit of the network model is access to quality healthcare at the right place and at the right time, while providing reliable lab and imaging support services to the doctors located in remote areas through an IT interface. For insurance companies, the advantage is that the model can help lower the cost of treatment through early diagnosis and filtering out patients for primary, secondary, and tertiary care treatment. The interest of several global players in India has gone up due to the country's world-class doctors, nurses, and enormous low-cost advantages. Rockland in particular has a very competent medical team and a robust healthcare delivery mechanism. The Rockland Group has already established cooperative relationships with foreign hospitals and medical specialists in several countries in the Middle East, Africa, CIS countries, and South Asia. Rockland's doctors are frequently conducting OPDs as well as conducting surgeries which can be performed locally in the target countries. For tertiary care and high-end surgeries, the patients are referred to the Rockland hospitals in India. Rockland has embarked on its journey to reach closer to the patients, aiming to connect with the masses. In the first phase of implementation, Rockland is already operating a number of primary care centers and OPD clinics in Delhi NCR and plans to create secondary care hospitals this year in Tier 3 towns in the states bordering the NCR. These hospitals will provide better infrastructure and equipment support, sterile operating and critical care facilities to doctors already practicing there, and will also empower them to seamlessly utilize tertiary care facilities of Rockland in NCR. The second phase will involve scaling up of the delivery mechanism to around 400 districts in North and Northeast India.